Hello, everyone, and thank you for taking the time to view our poster summarizing a faculty-led student research project in the Occupational Therapy Department titled The Social and Occupational Needs of Individuals with Parkinson's Disease, a two-part study. My name is Mackenzie Feldhacker, and co-author and co-PI of this project is Karen Hebert. We'd also like to acknowledge our student researchers who assisted with this project, Gabrielle Blecki, Caitlin Knockmoose, Alicia Perez, as well as Libby Stoutland. As occupational therapists, we are particularly interested in the social participation and occupational performance of our clients. And we were particularly interested in exploring this topic for individuals with Parkinson's disease because much of the literature related to PD focuses on the management of motor symptoms of the disease rather than the psychosocial and occupational issues that we know these individuals experience. So in that, the purpose of this study was to identify and understand the social and occupational needs of these individuals to be able to better support them in occupational therapy. This was a two-part descriptive study that utilized an online survey and an optional semi-structured follow-up interview. The survey sought to explore the social and occupational needs using Likert scale items that focused on changes in occupational participation as well as experiencing negative emotions. And there were also 5 categorical items related to the individual social roles and activity engagement. The follow-up interview was optional and completed after the survey and consisted of 6 open-ended questions regarding the individual's important social roles, any difficulties or changes in participation, and any areas of need. Overall, it was just giving them a chance to expand on some of their survey responses. So 13 individuals completed the online survey. Figure 1 shows the reported social role changes after their diagnosis of PD, and participants did report changes in their social roles, most notably in the roles of volunteer and organization member. That was 70% of the participants, as well as their role as family member, which was 58% of the participants. Figure 2 shows the reported activity engagement before their diagnosis of Parkinson's, and then difficulty with those same activities after diagnosis. And participants reported the most difficulty engaging in outdoor as well as sports and exercise activities. That was 61% of the participants for both of those types of activities. Additionally, there was change or difficulty reported in social participation for these individuals, and they also reported experiencing negative emotions when completing complex or challenging tasks. The semi-structured interview was completed by 8 of our participants, and through a process of open coding, there were 7 themes identified: changes in social participation, cognitive decline, disruption in activities of daily living, impact on IADL or instrumental activities of daily living routines, changes in leisure and work, increased health complications, as well as motor concerns. And if you look at the poster, you can see some examples of some of the statements that really exemplified those themes that were identified by multiple participants. So overall, our results demonstrate how the social roles and occupational performance of these individuals are negatively impacted by their PD diagnosis, which really adds to the limited literature that's looking at non-motor symptoms of this disease. Because OTs focus so heavily on occupational participation and allowing our clients to engage in meaningful roles, there's a great opportunity for OT practitioners to more specifically and regularly address these social and occupational needs in OT. The goal long-term would be that this evidence will support the development of future OT interventions that are specifically meant to address these needs identified through the study as well. If we look more broadly, all health practitioners should really be aware of the social and occupational needs of the individuals they are working with, specifically individuals with PD and individuals that are part of the geriatric population. We could draw some comparisons or explore further the occupational and social needs of those with other geriatric health conditions and compare the findings to this study. And by addressing the needs that were identified in this study, health practitioners can really learn how to better support and improve the quality of life of all the individuals that we work with, whether it be individuals with PD or just older adults more broadly. Thank you for your time, and please reach out with any questions.